previously HLH was considered to be a disease of young children. And there was really very little consciousness that this was something that commonly, or not commonly, but certainly with some frequency occurs in adults. And the reason that we felt like we should have a session devoted entirely to HLH in adults is because there is increasing recognition that people feel they're seeing more and more of it. And it's not clear whether it's actually increasing in incidence or whether it's a disease that is difficult to differentiate from other diseases, and therefore people haven't thought of the diagnosis. And it's a disease that if you don't consider the diagnosis, you won't make the diagnosis. In adults, it is most frequently misdiagnosed or confused with patients who present with
Hello and welcome to the next episode of the Explain series with your host, Dr. Brett Palmer. In the Explain series, we take a subject and explain it. And this time it's the turn of hemophagocytic lymphohistiocytosis, hence why we only call it HLH. Well, what is it? Well, it's quite a rare disorder, and so we're going to be doing some common disorders and some rare disorders as the week goes on. And it is effectively where the body makes too many activated immune cells. And there's all sorts of different type of HLHs out there. And it's like a number of conditions all combined into one. The most common is the autosomal recessive or hereditary form of HLH. You can also have an acquired form of HLH, but other types of diseases also fall into this category. And so one type is a macrophage activated syndrome, which is autoimmune associated. And so it covers a wide spectrum, this hemophagocytic lymphohistiocytosis. And so why is a sexual health doctor, not a hematologist, giving this presentation? Well, HLH does come about with viral infections, and some of those viral infections, or one of those viral infections would be HIV. And so I have seen this in practice, but it is quite a rare manifestation. So the causes, you can split HLH into two causes. On one side is the familial, and the other side is the acquired. Now, I'm not going to say too much about the familial, just to say there's 5 known types, and the immune system should really turn off cells that are no longer required, but there's obviously damage to these various areas in the human genome, as it were, and so the body doesn't destroy these immune cells. For the acquired type, the main bulk of it is either cancers or infections. A very, very common infection is the Epstein-Barr virus. So That's the same virus that causes glandular fever. And Epstein-Barr virus is a form of herpes virus. So there are quite a few human herpes viruses out there. So you've got HSV1 and 2, you've got VZV, and you've also got EBV, and there are others as well. Also, medications that suppress the immune system, other immunodeficiencies, autoimmune diseases, and as I said, certain types of cancers. In children, they get again a form of HLH, which can be an X-linked immunoproliferative disease, and a quarter of adults also show this, or especially of males as well, show this with Epstein-Barr virus HLH associated disease, and so it is strongly linked to males with an X-linked disorder as well. In terms of the viruses that are associated, I've just put here quite a lot of DNA virus, RNA virus, and an RNA retrovirus, HIV being one of them. And there's a whole plethora of viruses. So the human herpes viruses, as I said previously, and other viruses as well, and some of the rarer types like SARS or Crimean Congo hemorrhagic virus and hantavirus, rotavirus.
HLH, or hemophagocytic lymphohistiocytosis, is a group of immune disorders. The majority now have gene defects identified and abnormal immune system, in a way, overreactive immune system, as it's frustrated by its inability to control bacteria, viruses, typically viruses. This disorder is variable in its presentation. The very infantile form is very rapidly progressing and fatal within the first year of life, while there are some somewhat less aggressive, slower course subtypes as well. Transplantation, by replacing, again, an abnormal immune system, can be curative. We have a unique reduced toxicity regimen that permits transplantation not only of bone marrow of brother, sister, or a well-matched living bone marrow donor, but even those who do not have these donor options, we could very effectively transplant them with unrelated cord blood.
Move next to a story that has left many with questions. We are hearing from the fiance of 34-year-old ESPN reporter who lived in Atlanta, died after being diagnosed with pneumonia. Edward Ashoff passed away on Christmas Eve, his birthday. Ashoff's fiance in social media post describes him being hospitalized and then receiving treatment for a presumed diagnosis of HLH shortly before his death. It's something few of us in the newsroom had ever heard of, so we wanted to know more about what it is and the complications it can cause. And Joe Hinkie joins us now with a closer look at what is HLH. I've never heard of that before, Joe.
I hadn't until this case either, Ryan. It is potentially fatal, but we do want to stress here it is extremely rare. HLH is diagnosed in fewer than 1 out of every 50 to 100,000 children per year, according to the St. Jude Children's Hospital. Infants or young children are most often diagnosed, but it can also attack adults, as in this case. Atlanta area Dr. Will Epps tells me HLH causes the immune system to turn on and begin attacking itself.
But it just gets overworked and starts fighting regular tissues. So usually those tissues are organs like your spleen or your liver, and so it can result in liver failure or organ failure.
All right, Joe, now you mentioned that HLH most common in children, but Ashoff, as we've said, he was 34 years old. So what kind of leads into someone learning they have it?
There's two different versions here. There's what's called a familial or genetic version. That's more common in children. That's passed from generation to generation, and people are diagnosed with that at a young age. There's also a secondary version called acquired. This is more common in adults, with medical experts saying it is thought to come from certain infections, cancers, or autoimmune disorders. Pneumonia, which Ashoff said he was diagnosed with on social media, is included in that list.
Okay, so let's say someone is diagnosed with HLH. What's next? What are the treatment options for him here?
There's a variety of treatment options here. I'm told the main goal, though, is to focus on that immune system that is attacking itself and also to put HLH into remission.
Treating that is kind of tamping that down, either through steroids like dexamethasone or with like a chemotherapeutic agent, which those tend to lower your attack your immune system or lower that immune system.
Doctors, I'm told, will also focus on treating any underlying cause, such as pneumonia. According to Johns Hopkins Medicine, antibiotic or antiviral drugs can be used, or if drug treatments fail, doctors can turn to a stem cell transplant.